Yeah, hello doctors.
Hello.
So today we'll be discussing about MDCN in general. So MDCN is Medical and Dental Council of Nigeria. So the MDCN exam, let me just write it, MDCN exam is actually divided into two parts. There is the OSCE part and we have the MCQ part. Okay, so I'm just going to divide it out like this. Hold on. So let's assume we have the MCQs and we also have the OSCE parts. Please take note. Okay. So these
Yes, sir.
exams are actually exams that are written by foreign trained doctors for you to be licensed here in this country. So you have to write this exam. So we have the MCQs, and questions. And these MCQs, they are 300 questions. Okay, 300 questions. And these 300 questions, 50 are picture tests. 50 out of these 300 are picture tests. And the other 250 are actually the real MCQ. Lest I forget, the MCQs are single best answer. So you choose the single best answer, just one answer among everything. So you choose only one answer. And doctors, the 50 picture tests are actually very important in the sense that the 50 picture test actually carries a lot of mark. So I always encourage us, at least for you to pass MDCN exam, try as much as possible to get more than 50%, more than 50% of the pictures. Please take your time. And also your 250 pictures test is also very important. As far as I know, there have not been negative marking, but we don't know, things might change as time goes on. There's no negative marking right now. Or maybe in the next exam, try to confirm, try to be sure. And on the day of your exam, on the day of your computer CBT, which is the MCQs, you should try and ask the examiner that is there negative marking or not. What I mean by negative marking is if you choose a wrong answer, they minus your mark. So it's better to
Okay.
leave the questions unanswered. Do you understand, doctor?
Yes.
All right. So we have 50 picture tests and 250 MCQs. Okay. And these exams, they are written in different days. The MCQ is written first, followed by the OSCE. Majority of people coming from the Euro, probably Ukraine, Russia, probably maybe some of us are not used to OSCE stations. Yeah, they are. It depend on the teaching hospital or the way MDCN set their exams. There are different. Sometimes they can be 5 stations. Sometimes they can be 10 stations. But in recent time, it's always 10 stations. So each station is 5 minutes. Okay. So for these stations, I will still come back to MCQ later, please. If you have any, please, do you have
Okay.
any question regarding MCQ, like this other parts of
No.
MDCN exam? Okay, you understand
No.
everything, right? So this
Yes.
other part is the OSCE. OSCE is OSCE. Yeah, the objective structured. What again, doctor? What's OSCE? What's the full meaning of OSCE?
Holistic structured clinical. I'm
Clinical.
not sure.
Yeah, it's clinical
Examination.
examination. Yeah, you're
Yeah.
correct. It's actually correct. So these exams, there are 10 stations. We're going to discuss about the stations. So surely, definitely, in these stations, you are going to get, there are some certain stations that is sure that's going to come out on that day. And one of the stations that is going to come out is clerking. Clerking is the same as history taking. Okay, we call it clerking or clerking, whichever. So clerking is more of like history taking. So you have to show that you can take history from a patient for you to work in Nigeria. So one of the stations will be clerking station. Definitely you are going to get it. And please, these stations are very important. You shouldn't fail it. So I will encourage us to go through each clerking. There are high yield topics. You need to be able to clerk. And there are common things like probably fibroid, hypertension, congestive heart failure. You should be able to take history of this in this station. You have 5 minutes actually to take the history. in our previous videos or in subsequent video, I'll be making videos on some certain clicking on how to go about it. And the other thing that is very important that might probably come out is, that is always sure, it's not probably, it will definitely come out, is counseling. So counseling station is always sure. You might be presented with, maybe you are present with a woman who is having fibroid, or maybe a woman wants to go for myomectomy. You will be probably asked to counsel her regarding the procedure. So you should be able to counsel her. Or probably you might be given any case, maybe febrile seizure, you should counsel. So there's a scheme on how to counsel on the videos. I've been posting some of them. I posted vesical vagina fistula VVF. So it's also sure station that you are going to get. And another station that is also very important that you are going to get is physical examination. Okay? So
Yes.
you'll be given a patient, there will be a simulator, and you'll be asked to do some physical examination on these simulators. This is very important. Please take note. So physical examination station is a very high yield station. It's a very important station. So these three stations are sure, definitely, you are going to get these stations. You are going to get questions on this station. So it's very important, please, doctor. And in recent times, they do bring two clerking stations, two counseling stations, two physical examination stations. There's around about 6 stations already out of
Six
10.
stations.
Yes. So it's
So,
like,
so what stations make up the other four stations that you talked about?
yeah, the other stations that will probably might also come out is you might get stations on levels of prevention. Sure, you will get it actually also. Levels of prevention. I made a video already about levels of prevention, introduction to levels of prevention, what you need to know about levels of prevention. There was a time they asked about waterborne disease. There was a time they asked about levels of prevention, I think malaria or something, applied it to it. So you should know the levels of prevention. They're a very high topic. You should know some of their topics. You can check on the subsequent videos for levels of prevention. Okay?
Okay.
So that is one station. So sure, doctor, you are going to definitely get these stations, these 4 stations above here. Okay? So another important station that you also get for this OSCE exam is you might get a station where you'll be asked about symptoms, signs and symptoms,
Yeah.
about symptoms. Okay? So what do I mean by symptoms here is they give you, what's it called? A case. Do you understand? They give you a case. So symptoms will also be asked. They are very important stations that will
Yeah.
be also asked. So they will give you a case. Let's say a case, and they will ask you which symptoms and which systems are affected. And they will ask you to mention at least 10 symptoms each in each of the symptoms. And
Okay.
10 symptoms each in each of the system that is affected. Maybe in the case, the gastrointestinal system is affected, the respiratory system is affected, the digestive system is and the gastrointestinal, let's say the musculoskeletal system is affected. So you have to write 10 symptoms each in those stations. Sometimes they can bring it like that, and sometimes they can just give you a case, and maybe previous one they were asking about thyroid, and they asked about symptoms on thyroid and to give diagnosis. So this station is very important. It's a venture station. You shouldn't fail this station. It's a very high station. So they don't expect anybody to fail
Really?
this station. Please take notes. It's a
All
very
right.
easy station. And I will always advise, before you start with the system affected, always try to come with a diagnosis. And from there, you'll be able to know the systems that are affected. Do you understand, doctors? Another
Yes.
important station that you probably might be asked is stations on, let's say, lab value, labs value. Okay? You might get a station where there's a lab value, and they will probably, you have to interpret, you have to give a diagnosis. Okay?
Yeah.
And apart from that, also, subsequent times, there have been stations where they put X-ray, CT scan, imaging, let's say, imaging. This is not probably sure, like it might varies. You understand? It might not be
Yes.
exact imaging, so it might vary. So you might get imaging, you might get CT scan. There was a time there was CT scan, I think epidural, subdural, and hematoma. So you be
Okay.
asked to identify it or give a diagnosis in one of those stations. You understand, doctor? These are very
Yeah.
important stations. So I think in summary, these are the main thing you need to focus on. There are also other things that might be asked, but just in general overview, these are the things you'll be asked. Please, doctor, your MCQs are very important. A lot of people have issues with MCQ. So for the MCQs, I will encourage us to study pictures a lot also. I'll be posting, doing some pictures tests. I'll be posting it on YouTube so you can all have access to it. And apart from that also, you can join some tutorials where they do MCQs all the time. It will really help. Join the Mdcn page, which will really help you a lot. So join the main Mdcn page, join the MCQ session to really help, and have a study group, have a study partner, and go through MC. At least every day you should go through MCQs. You can pay for this MCQ page, and you can also get past MCQs from from different teaching hospitals. Their final year students. You can go over these questions and go through their picture tests. You understand, doctor?
Yes.
Yeah. So any question regarding the MCQ and the OSCE part, and don't forget both of them are written in different days. They are written in different days. Yeah. So the first one they normally write is the MCQ. Then after the MCQ is the OSCE. There might be more things they might have in the OSCE. If you have questions, please, you can let me know. Any questions?
Fully understood, Doc.
Okay. In the absence of question, please, for those that will be seeing this video later, you can always drop comments if you have any thing to say. All right. Yeah, that will be it.